Coming up on District Wire News Health Edition, the Affordable Care Act website 1 month later, why some Americans still can't get health care. We'll tell you in today's episode.
And America's obesity epidemic. Obese children in the U.S. are hitting puberty earlier than their healthier classmates. This special edition of District Wire News starts right now.
Good afternoon, I'm Isabella Diaz.
And I'm Sydney Kashiwagi. Researchers from Ohio's Cleveland Clinic say that newer blood and better management of blood storage time could reduce the risk of complications from blood transfusions in patients. A study published from a doctor from the clinic says that stored blood undergoes changes, which means transfusion of older red blood cells may contribute to adverse clinical events. Doctors from the Cleveland Clinic say that hourly checks and more frequent deliveries from blood collection agencies could help to ensure that blood is used within the right time frame.
A study from the National Cancer Institute released last week says that one cervical cancer shot or Gardasil shot, rather than 3, may now be enough to prevent cervical cancer. The current cost of the 3 shots series costs $130 per shot in the U.S., and the cheapest international 3-series shot costs $13. Experts say reducing the number of doses to just 1 could be helpful in developing countries and impoverished regions in the U.S., and could increase the likelihood that women around the world get the vaccine.
Do you speak French? Parlez-vous français? Speaking that second language can help ward off early onset of dementia. Scientists in Edinburgh found that people who speak more than one language tend to develop dementia 5 years later than people who only speak one language. People that are multilingual also tend to experience later onsets of Alzheimer's disease. Researchers are now saying that bilingualism might have a stronger effect on dementia than any drug currently available.
Insurers are now required to cover addiction and mental health as they would cover mental health illnesses. The Obama administration made the announcement Friday morning at a mental health conference in Atlanta. The new ruling will guarantee that co-payments, limits on visits to providers, and deductibles for mental health benefits will be the same as the medical and surgical benefits with health plans. This should apply to almost all types of insurance.
Labor unions may get a tax break from some Affordable Care Act fees. The Obama administration said it intends to propose rules that would exempt certain self-insured, self-administered plans from the temporary reassurance fee. The temporary reassurance fee is intended to raise $25 billion over the next 3 years, and labor unions are skeptical about how many of their plans the levy will affect.
President Obama personally apologized to Americans who are losing their health care coverage. The president said that he was sorry Americans lost their current plans as a result of the Affordable Care Act. This apology comes following the president's prior promises that if you like your health plan, you will be able to keep your health plan. However, the Department of Health and Human Services estimated in 2010 that upwards of 9 million consumers could lose their coverage under the law. It's now been 1 month after the Affordable Care Act launched, and some people still don't have health care. Meanwhile, problems with healthcare.gov continue as people are unable to fill out their online applications. Growing concerns about the policy behind the ACA are leading healthcare experts to question the benefits of the act. Joining us now to talk about some of these concerns is Robert Karsh, a health policy expert and professor at American University. Professor Karsh, it's a pleasure to have you in the studio with us today. Welcome to District TV.
Thank you, Isabel.
Well, one of the questions I have for you is just an overview of what the Affordable Care Act is. I know some of our viewers may be a little unfamiliar, a little fuzzy on some of the little details.
Yeah. January 5, 2010, the Affordable Care Act became law. The timing is interesting. It was in January, during a recess period when the Democrats controlled both the House and the Senate, and they passed a massive bill that has a lot of really good stuff in it. But the process of trying to get that bill to become law, or it is law to become really reality, has been a real challenge at several things. Most recently, the challenge has been trying to get the automated process, the website that we hear so much about, to function in such a way that people can actually access it to determine if in fact there's a policy there that they want and to sign up for it. That's a simplistic view, but there's a lot of really good stuff for good intentions there. I might add that it's not new. It's new now that it is law, but there have been numerous attempts over the course of history to try to provide these kinds of programs and services for people in our country. Perhaps the one that perhaps people remember more recently was the First Lady when President Clinton was first into office, initiated a major action to try to put through a number of major reforms. It didn't work at that time, but many of the ideas that were advanced at that time in the early 90s are now back and actually are part of this law.
So we talked a little bit, or you talked a little bit about some of the potential pros to this program, why it could be good. Are there potential cons? There are some people that are a little worried about the Health Care Act, or they're not really sure about it.
Right. There are a number of issues. The one that we're hearing so much about now are the technical issues, the website not working, and that's a critical element to it because that's where people would go to get information. It's unfortunate. It's become very costly. You'd think with all the other successes that we've had in this country, advancing technology, space race, among other things, that this problem wouldn't have occurred, but it did. It is where it is. I think it will be solved in time. We certainly have the capabilities of solving it. How soon, I don't know. The bigger issue will be then the cost of the health care program itself. That's really the sort of the elephant in the room, if you will, that has to be addressed, because right now the Affordable Care Act under its current structure is not affordable and in a real sense, so it's kind of a misnomer.
I was wondering you could talk to me a little bit more about the people that are losing their health care coverage. As we talked about a little bit prior to starting this interview, some people were told that they would not have to worry about losing their coverage, and yet some people are. Why is that?
I think there's a long answer to that. Why? Part of it's politics.
Okay.
You know, I think in order to get the act passed, to get the votes to pass it, and then to drive it into our country, into our society, some promises were made where people didn't refer to the small print or the fine print that really explained the programs. There are changes in policies every year. People can go and change their policies, so there is a flux in healthcare coverage. But it appears that based on a number of factors, that insurance companies are changing their or dropping policies because they are not in compliance with what's in the law, and therefore they can't offer them, and so they are dropping people. Other people that don't have insurance are looking to how they can get insurance through the exchanges and so on, which is difficult because of the lack of the technology to sign up.
Well, thank you so much. We appreciate all of your insight. Health policy expert, Professor Karsh, we appreciate having you on the show today.
Thank you.
Thank you.
Later in the show, we'll discuss the political struggle that's going on behind the scenes of the Affordable Care Act and how the controversy surrounding its launch is affecting the Democratic Party and the upcoming 2014 elections.
The Food and Drug Administration is trying to create a non-addictive cigarette. Researchers for the FDA are trying to create a nicotine-free cigarette which would make cigarettes non-addictive. The government says they are hoping this will help teens not get hooked and will lead to less addiction among new smokers. But the administration says not to expect a low nicotine product for a few years as research has just begun. This new measure is an attempt by the FDA to increase regulation of tobacco products.
If you notice people sneezing around you with runny noses, it's because fall allergy season is in full swing. The Washington Post has outlined a list of how to prevent fall allergies. Some of their tips include avoiding fruits like apples, bananas, and peaches that cause allergic reactions. Keeping your pillow as new as possible. A pillow older than 3 years is most likely loaded with dust. And they even say to freeze stuffed toys for up to a month to prevent the buildup of mites. For more tips, check out the Washington Post website.
Is your dog relaxed or stressed? Researchers say the answer is in the tail wag. The direction of the dog's tail wagging indicates the emotional response of its fellow dog peers. A tail wag to the right makes the dogs relaxed, while a tail wag to the left gets the other dogs stressed. The study surveyed over 40 different breeds of dog, monitoring their heart rate and observing videos of the dog's tail wags.
Coming up after the break, vegetarians and vegans are living longer. Does going meat-free really make you healthier? Jade Vakil has more.
Plus, is obesity causing some kids to go through puberty early? We have the story coming up. Stay tuned.